In the last 8 out of 9 days, around 30% of new COVID cases are in our youngest population, between the ages of 0 to 19. That is the longest time it has been at this percentage in this age group since the very start of the pandemic. The rising school-age cases come as administering vaccines to children aged 5 and up seems to be inching closer to reality, while a school in Curtis has had to close. The school announced it is shutting down for at least 2 weeks due to 11 cases among students and staff, with more expected. The board will not confirm the source of the first case or whether all staff are vaccinated.
We can't comment on the vaccination status of students or staff.
According to the province's website, 779 schools, or 16%, have COVID cases. Despite those growing numbers, Ontario's cases overall are not spiking.
COVID is going where it can. It's finding those kids, many of whom are not vaccinated over the age of 12, none of whom are vaccinated under the age of 12. So that's exactly where we're seeing our cases. The only surprise is that we're not seeing a higher proportion of cases in those groups because our vaccination elsewhere is really, really good.
Today, Toronto's Board of Health voted unanimously to ask the province to make COVID-19 vaccinations mandatory for eligible students. The Minister of Health did not answer if the government will take that action.
Well, we're going to take a look at anything that is going to protect people, including young people. Now we're waiting for finalization on whether the Pfizer vaccine in particular can be used for children age 5 to 11.
Toronto Public Health also announced today it's getting ready to vaccinate children aged 5 and up if or when Pfizer vaccines are approved for that age group, and has formed a COVID-19 vaccination planning group to prepare for the rollout.
Will vaccinating children over the age of 5 be a game changer?
Yes, certainly in the Greater Toronto area, it will bring us pretty much to that herd immunity level where COVID just won't circulate. If we're going to have a bad month, it's probably going to be October. And I say that because that's where we have the continuation of what we have now, which is a growth in cases in schools. But we'll see a post-Thanksgiving bump, and that'll take us into November.
So the question for so many parents of young children is, when could the Pfizer vaccine be available for those who are 5 and up? Government officials tell me they are hearing it could be approved by Christmas.